Introducing the Airlift procedure for obstructive sleep apnea, a new approach to hyoid suspension. Developed by Siesta Medical. Airway blockage in obstructive sleep apnea, or OSA, occurs when a person's airway muscles become overly relaxed during sleep, fall back, and allow the airway to collapse. For most people with OSA, the collapse can involve both the base of the tongue as well as the side walls of the airway on either side of the tongue. The human airway is a complex structure made up of many muscles, ligaments, and other connections to the bones that surround the airway. The tongue and many of the muscles that support the airway are connected to the hyoid bone. The horseshoe-shaped hyoid bone surrounds the airway and plays an important role in keeping the airway open. Doctors treating sleep apnea discovered that lifting and suspending the hyoid bone created tension in the airway muscles and helped to prevent airway collapse. Until now, doctors didn't have a simple and easily controlled way to lift and suspend the hyoid bone. Siesta Medical has developed the ideal system of implants and instruments for performing hyoid suspension in a simple and safe procedure. The procedure begins with a small incision under the chin. Two very small suture anchors are placed under and behind the chin so that they cannot be felt. The hyoid bone is located and a clamp is used to secure it and lift it towards the incision. The revolution suture passer, which simplifies passing suture, is used to place two loops of suture around the hyoid bone. These sutures are then attached with girth hitches and threaded into the suture anchors. With the head in a neutral position, the hyoid bone is lifted and suspended to the mandible by locking the sutures to the suture anchors. With encore suture anchors, the position of the hyoid bone can be easily controlled and adjusted at a later date. This is a feature not available in other systems. The incision is then closed. Most patients can eat a normal meal after the procedure and discomfort is minimal. The airlift procedure is completely reversible and removable. In some cases, lifting and suspending the base of the tongue may be recommended by your doctor to further open the airway. Through the same incision, a third suture anchor is placed in the mandible, and a stitch is placed in the base of the tongue with the encore suture passer. The suture is then exchanged for a suspension suture and threaded into the third anchor. The suture is tensioned, lifting and supporting the tongue, and locked into the anchor. Consult with your doctor to find out if the airlift procedure might be beneficial for your sleep apnea.